Most people believe heart disease begins with high cholesterol, but when cardiovascular surgeons examine real arteries inside the human body, a different story emerges. Patients with normal cholesterol often present with severe arterial damage, while others with elevated cholesterol maintain surprisingly healthy vessels. This contradiction reveals a critical truth most health discussions miss. The real battlefield of heart disease is not cholesterol itself. It is inflammation and damage within the arterial lining known as the endothelium. Your endothelium is a microscopic single-cell thick layer lining every blood vessel in your body. It regulates circulation, controls vascular relaxation, prevents abnormal clotting, and maintains smooth blood flow. When this protective barrier becomes inflamed or injured, cholesterol particles become trapped inside the arterial wall. Immune cells respond, plaque forms, arteries gradually stiffen and narrow, blood pressure rises, circulation declines. The disease process begins not with cholesterol alone, but with a damaged vascular environment. The remarkable insight emerging from decades of research is that arterial healing is biologically possible, not through extreme restriction, not through eliminating entire food groups, but through strategic meal construction that reduces inflammation and supports endothelial repair. Food is not simply fuel, it is biochemical instruction for your vascular system. To support arterial health consistently, every meal should include 5 functional components that work together physiologically rather than individually. This content is provided for educational purposes only and is not intended as medical advice, diagnosis, or treatment. Always consult a qualified healthcare professional before making decisions about your health or medications. The first component is anti-inflammatory omega-3 fatty acids. These fats actively regulate inflammatory signaling inside blood vessels. They reduce excessive clotting tendency, stabilize existing plaque, and improve endothelial responsiveness. Omega-3 fats are not interchangeable with other fats. Their molecular structure directly influences cellular communication. The most effective sources include wild salmon, sardines, and mackerel. Plant-based sources such as walnuts, chia seeds, flax seeds, and authentic extra virgin olive oil also contribute protective effects. Clinical studies repeatedly show improved arterial flexibility when omega-3 intake is adequate. Blood vessels become more responsive, circulation improves, and inflammatory markers decline. The second component is soluble fiber from whole vegetables and legumes. Fiber performs far more than digestive support. It binds inflammatory compounds in the gut, modulates cholesterol metabolism, and nourishes beneficial microbiota that produce anti-inflammatory metabolites circulating throughout the body. Dark leafy greens, cruciferous vegetables, lentils, chickpeas, and beans provide powerful fiber support. Fiber also protects LDL cholesterol from oxidative damage. LDL becomes dangerous only after oxidation transforms it into a form that embeds within arterial walls. Fiber helps prevent this transformation. When fiber is consumed alongside healthy fats, the inflammatory response to food changes dramatically. Whole food synergy matters more than isolated nutrients. The third component is polyphenols and antioxidants from colorful plant foods. These bioactive compounds neutralize free radicals before they damage endothelial cells. They enhance nitric oxide production, the signaling molecule that tells arteries to relax and dilate. Sources include berries, herbs, turmeric, ginger, green tea, dark chocolate, red cabbage, beets, and vibrant vegetables. The color diversity of your plate directly reflects protective compound diversity. Research demonstrates measurable improvements in arterial elasticity within weeks of increasing polyphenol intake. Blood vessels become more flexible even before weight changes occur. The fourth component is high-quality protein in moderate amounts. Protein selection influences inflammation, metabolic function, and tissue repair. Optimal sources include fatty fish, legumes, eggs, and moderate poultry intake. Heavily processed meats and excessive saturated fat in an inflammatory environment can destabilize plaque and increase vascular stress. This balanced protein strategy helps explain why Mediterranean dietary patterns consistently reduce heart attacks and strokes by 30 to 40% in large clinical trials. The benefit is not mysterious. It is the predictable outcome of combining omega-3 fats, fiber-rich plants, polyphenols, and quality protein within the same meals. The fifth component is glycemic stability through whole food carbohydrates. Repeated blood sugar spikes damage arteries even in individuals without diabetes. Elevated glucose triggers oxidative stress and glycation, a chemical reaction that alters proteins and lipids, impairing vascular function. Whole carbohydrates such as quinoa, steel-cut oats, sweet potatoes, and legumes digest gradually, preventing glucose surges. Refined starches and sugar-sweetened beverages create the opposite effect. Stable glucose levels protect endothelial integrity and reduce inflammatory burden across the cardiovascular system. Beyond food selection, lifestyle timing significantly influences vascular health. Eating large meals late at night places metabolic strain on the body when insulin sensitivity and vascular responsiveness are naturally reduced. Completing your final substantial meal several hours before sleep lowers overnight triglycerides and reduces inflammatory stress on arteries. Another underutilized strategy is brief post-meal movement. A simple 10-minute walk after eating improves circulation, stimulates nitric oxide release, and enhances glucose regulation. Identical meals produce different physiological outcomes depending on whether movement follows. Small actions generate measurable vascular effects. A practical example of an artery-supportive meal could include wild salmon seasoned with herbs and lemon, a large mixed salad with leafy greens and walnuts dressed in olive oil, and roasted cruciferous vegetables. A plant-based alternative could include lentil soup with vegetables and olive oil alongside fresh berries. Different cuisines can apply the same biological principles. These patterns do not require rigid dietary rules. They require strategic combinations. Food works best when components interact. Most individuals focus intensely on total cholesterol numbers, yet this measurement alone reveals little about cardiovascular risk. Particle size, oxidation status, inflammation, and metabolic health matter far more. One simple indicator provides deeper insight: the triglyceride-to-HDL ratio. Lower ratios reflect improved insulin sensitivity and reduced inflammatory burden. Nutritional strategies emphasizing omega-3 fats, fiber, and whole foods improve this ratio rapidly. However, nutrition alone cannot fully protect arterial health if chronic stress and inadequate sleep persist. Stress hormones elevate blood pressure, increase insulin resistance, and promote inflammation. Sleep deprivation produces similar physiological disruption. Consistent restorative sleep and stress regulation are foundational cardiovascular therapies. Improving arterial health does not require perfection. It begins with a single intentional meal. One meal constructed with anti-inflammatory fats, fiber-rich vegetables, colorful plants, quality protein, and stable carbohydrates. Eat mindfully. Move briefly afterward. Repeat periodically. Over time, this becomes a sustainable pattern rather than a restrictive diet. This perspective aligns closely with what you have already seen in discussions about sugar's role in hypertension and the cardiovascular power of specific vegetables. The unifying principle remains inflammation control and endothelial protection. Whether reducing hidden sugars, limiting ultra-processed foods, or constructing therapeutic meals, the biological objective is the same: create an internal environment where arteries can function normally. Heart health is not achieved through fear of food. It develops through intelligent physiological support. Reduce inflammation, support endothelial repair, maintain stable metabolism, move regularly, sleep adequately, manage stress. These are not temporary interventions. They are structural conditions for long-term vascular function. You possess substantial influence over arterial health through daily choices. Begin with your next meal, not next week, not next month. The next time you eat, construct a plate that supports your blood vessels rather than challenges them. This information is provided for educational purposes and does not replace professional medical advice. If this perspective reshaped how you understand heart health, share it with someone who still believes cholesterol numbers alone define cardiovascular risk. Your understanding is your advantage. Your arteries are living tissue, and they respond to what you do every day. Small nutritional shifts, consistent movement, quality sleep, and stress control create measurable, biological change inside your blood vessels. If this video helped you understand heart health at a deeper level, support the channel by liking the video and sharing it with someone who still believes cholesterol alone determines cardiovascular risk. Subscribe for more evidence-based insights on blood pressure, arterial health, and therapeutic nutrition. Thank you for watching, and I'll see you in the next video.